Hi, I'm Danielle Matus at Caring Medical Florida, talking to you today about Morton's neuroma, which is actually a very common condition that we see in our office. For those of you that may not know, Morton's neuroma is basically when these little nerves that run in between our toes get really irritated and cause a lot of pain and dysfunction. So people that have been diagnosed with a Morton's neuroma might, often feel like they're walking on a rock or there's a small pebble in their shoe. And it can be associated with a lot of pain, maybe some nerve-like symptoms, burning, tingling, sharp shooting pains, and even like toe instability where that toe is clicking, popping, cracking, and hurting as well. Most often what we see in our office is people that have Morton's neuroma that have failed other types of treatment. So they've failed other types of injections like steroids, they've tried changing their footwear, they've tried changing their activity, but this condition still persists. What we often see in our office is that people have joint ligament issues. So like here are our toes here. There's ligament injuries to these joints here that's allowing those bones to move more than they should. And then what lays right next to the bone but that nerve? So if that bone is moving, even a millimeter, it can continually smash on that nerve, causing that nerve to swell, take up more space, be more easily pinched, and that's how this whole kind of cascade starts. In cases where the patient has toe instability, which we can diagnose on a musculoskeletal ultrasound, those are the cases where we actually would choose to treat this condition with prolotherapy. Now, sometimes all we have to do is, dextrose prolotherapy, maybe PRP, to these joints here to get them to be stable and strong, get the pressure off the nerve, and then everything else kind of falls into place. Sometimes the more chronic the conditions, we actually have to do some injections around the nerve itself to get it to heal, which is called neural prolotherapy. And oftentimes we will do those together in tandem to work on resolving the condition. We do have to talk about footwear, of course, and proper exercise and, getting your feet strong. But overall, patients with this do very well. This is a study actually that Dr. Hauser did on patients with unresolved Morton's neuroma pain. And if you look here, the blue is the patient's response before any prolotherapy treatment. So average pain at rest, just shy of a 5. Pain with activities or while exercising is kind of up in that 7 to 8 range. Pain while walking barefoot, also a very common thing. People with Morton's neuroma don't typically like to walk barefoot. They want a more supportive shoe. Toe stiffness, and then that numbing, burning, kind of nervy symptoms that we talked about before. The red is their response after prolotherapy treatment. So you can see significant reductions across the board in all of these after prolotherapy to their toes.